Well, good afternoon, everyone. My name is David Wicks. I'm Vice President of Listings here at Nasdaq, and it's truly my great pleasure to welcome Madrigal Pharmaceuticals. October is Liver Awareness Month, and we appreciate that Madrigal is using our closing bell ceremony to draw attention to the need to love your liver and announce its support of the Fatty Liver Foundation. Both Madrigal and the Fatty Liver Foundation are committed to improving the lives of people living with non-alcoholic fatty liver disease, or NAFLD, a condition in which fat builds up in your liver. Excessive fat in the liver can lead to non-alcoholic steatohepatitis, or NASH, the most aggressive form of NAFLD. NASH can be life-threatening as it can cause liver scarring or cirrhosis and lead to liver cancer. It's estimated that 3 to 5% of the global population is affected by NASH, though the disease is considered to be underdiagnosed. NASH is known as a silent disease because many people don't know they have it until it's progressed to a dangerous stage. To help address this underdiagnosed disease and in recognition of Liver Awareness Month, today Madrigal Pharmaceuticals is announcing its support of the Fatty Liver Foundation's screening fund to improve the diagnosis and staging of NAFLD and NASH. Madrigal is a clinical stage company, and over the past several years, Dr. Paul Friedman, Madrigal's chairman and CEO, and Dr. Rebecca Taub, founder, chief medical officer, and president of research and development of Madrigal, have assembled an experienced team with proven expertise in liver diseases. Madrigal's lead product, resmetirom, is nearing completion of a rigorous phase 3 clinical development program. Resmetirom has the potential to be the first to market FDA-approved therapy for people with NASH, transitioning Madrigal into a successful commercial company. Madrigal's support of the Fatty Liver Foundation, the only national nonprofit patient organization dedicated to improving the identification, diagnosis, treatment, and support of Americans with fatty liver diseases, aligns with the company's commitment to increase the medical and patient community's understanding of the disease to better identify and support those who are impacted. Now, please join me in welcoming Dr. Paul Friedman, Madrigal's chairman and CEO, for a few words before we ring today's closing bell.
Madrigal is a public clinical stage biopharmaceutical company trading on the Nasdaq Stock Exchange. We're committed to developing a potential first-to-market transformational therapy for patients with non-alcoholic steatohepatitis, or NASH, N-A-S-H, the advanced form of non-alcoholic fatty liver disease, or NAFLD, N-A-F-L-D. And NASH is characterized by excessive fat accumulation in the liver, inflammation, that is hepatitis, and liver scarring, that is cirrhosis. This can increase the risk of hepatic failure as well as liver cancer. In the United States, there are an estimated 16 million people with NASH, a number that is anticipated to continue to grow. October is Liver Awareness Month, and we're using the month to highlight the importance of the negative health consequences of fatty liver disease, which also include increased risk of cardiovascular events such as heart attack or stroke. At Madrigal, we want to increase awareness of NASH and transform its diagnosis and treatment through our clinical development program and via partnerships with patient and healthcare communities. As such, we're partnering with the Fatty Liver Foundation and actively supporting their objective to improve the medical and patient community's awareness and understanding of NASH. We also want to communicate the growing body of clinical evidence demonstrating the use of non-invasive tools and techniques to screen and diagnose patients. Greater awareness, simplified diagnosis, lifestyle modifications, and when appropriate treatment can reduce the burden of this disease in America.